You're welcome to another exciting edition of your favorite program, Health Affair on AIT. I am your regular anchor, Ushuomowa Daniels. On the program, we focus on critical public health issues, challenges of women and children with a view to finding lasting solutions. On today's episode, we shall be focusing on infertility, the causes and solution. But before that, let's take you through our news segment. To ensure that residents in Lagos State, especially those in the rural communities, stay healthy, with the COVID-19 pandemic still ravaging across the globe, the Lagos State government, in collaboration with Boskoh Healthcare Mission International, has started a free medical mission across the state. The program, which was flagged off on the 29th of June 2021 at the Police College, has so far benefited close to 10,000 people, especially market women and men.
Káàkiri, Jígí Bọ́lá relaunch, ọ̀fẹ́ ni, tètè náà, ọ̀fẹ́ ni, àwọn kìíní yẹn wọ́n, àwọn kìíní etí yẹn wọ́n gan-an, ọ̀pọ̀lọpọ̀ wọn ò lè afford ẹ̀.
Health is wealth, so they say. So if you are wealthy, and you might have this problem without even knowing until you are being tested. Now, if they are tested and they realize that they needed the glasses or the treatment, they follow the prescription, and they would always remember the government of the day and appreciate the impact the program is having on them.
Focus is to see that every Lagosian up to the grassroots are able to get health care. Lagos State government, thank God for the governor of Lagos State, who is doing tremendous work here, and his deputy. They're doing a fantastic work in the healthcare section, but it's still important that we're still driving it into the grassroots.
Association of Commodity Market Women and Men of Nigeria appreciate you. They do us as if they know us before. They treat us as if they know us before, and they don't collect 10 kobo from anybody's hand here.
To reduce the increasing rate of blindness and eye diseases, a special attention is being given to eye care with the support of the Jigibola Eye Care Initiative.
We also have the Jigibola, which is the eyeglasses we're giving to people, which comes as reading glasses and also recommended glasses. We're doing all this so that people will be able to take care of their sight. They don't have to get blind before they start getting quality assistance. So we're coming to the communities, we're coming right to their doorsteps to meet them, that they should have their eyes checked.
Drugs they use commonly here, that is affordable, available, produced even here, is cannabis sativa, popularly called Igbo, or what people call marijuana. That's not to say there are many drugs now trending, Even in our local parlance, you see people doing soak and die, they sniff batteries, cow dungs, and all that songs. Some people even mix Milo with all manners of things. The another new trend is the intake of tramadol.
Drug use habits in Nigeria has continued to evolve, with young people resorting to potent mixtures of several drugs at the high risk of fatal overdoses.
The alarming statistics made available in recent times have revealed that in the first 6 months of this year, the NDLEA has seized over 7,000 kilograms of various illicit drugs and substances with the assistance of their sister security agencies. Therefore, one may begin to wonder if these substances had been able to reach the public and had not been intercepted through the untiring efforts of these agencies, it would have trickled down into the society for consumption.
More worrisome is that nearly 15% of adult population in Nigeria have been reported to use a considerable level of psychoactive substance. With the theme, Share Facts About Drugs and Save Lives, parents were particularly charged with a greater responsibility in the fight against drug abuse.
And I want to employ all Nigerians from all walks of life I want to employ government. I want to employ politicians, politically exposed people to come on board to assist NDLA in carry out this fight.
Eradication of drug abuse is when we collectively understand the message and put it out there for the public.
Take it from the very beginning. Every individual you see belongs to a family. Right from the very beginning, if you are brought up in an environment that tells you that this behavior is not acceptable, we don't want you to do this, these are the results of whatever it is you do, I think we'll be there.
The International Day Against Drug Abuse and Illicit Trafficking is celebrated 26th June every year to strengthen action and cooperation for a drug-free society.
Another Ibadan Grammar School people. Going. God. Congratulations.
That was the formal installation of the changemaker, Remi Bello, as district governor 2021 to 2022. With his track records, many are optimistic that he will deliver on his promises to change lives.
That is about hygiene. We want to prevent disease. So by adopting public primary schools where we are doing what we call WASH, water, sanitation and hygiene. Our clubs, we are poised to go for 30 public primary schools in different parts of Lagos and Ogun State, whereby we are going to provide water, we are going to provide sanitary, we are going to provide hygienic environment for our children in the public primary schools. That's one of our key projects. And we project that project will be costing us over 100 million naira. And we have also what we call DEEP, District Empowerment, Economic Empowerment Program, whereby we empower our women, especially with a maximum of 100,000 naira to assist them in their business so that they will be in position to sponsor the education of their children. The foundation is the heart and soul of Rotary. That is where we do good we are doing in the world. Those are the things we plan to do. We plan to raise about $1 million for Rotary Foundation. Rotary Foundation has led the fight against polio, and we are doing a lot of work on COVID-19 as we are talking. So we are planning to raise about $1 million. We've been on this goal in the last 3 years.
So I'm so happy that a man who is worthy in every respect to be a district governor is being installed today as district governor. He's such a wonderful human being.
So I'm sure that, and you look at his pet project, it's quite laudable. So we should all support him, and I believe that he will achieve the program. He wants the good of everybody around him. So it is not by accident as a Rotary. You know, when he was 50, he single-handedly bought a land, built a school, the Midday Primary School, you know, and handed over to Ogun State government. Today they have. That was when he was 50 years old as president of the Rotary Club of Lagos. He did that project at that time, you know, 2007, 2008 Rotary year. And that school is still there today with over 600 pupils. The Rotary have what we call 7 areas of focus, whether it's child and maternal health or basic literacy and education. There's so much we do. And this year, the district governor is encouraging clubs, Rotary clubs, to adopt schools, talking about public secondary schools, you know, and renovate those schools, equip those schools, because education is very key. Without knowledge is power.
Changemaker because in the team of Rotary for this year, this is a year that we have said we want to serve to change lives, and we have themed this year as a year where we want to bring about changing the life of people. Recall that up till now, COVID has ravaged the world. So we are going to do things differently, the way the world has also transformed, to be able to change life and add value to humanity.
I wish him to do more than what we have done in the last Rotary year. I wish him all the best.
For everything in life, there is a time to begin and a time to end. For Rotarian Funke Doris Salau, the 26th of June 2021 was the day to formally hand over the baton of leadership as president of Rotary Club, District 9110. As she stepped up the podium, she could recall how her service year started with uncertainty due to the outbreak of the COVID-19 pandemic. But eventually, everything turned out for good. Working together with a team spirit that makes Rotary tour across the globe, she was able to accomplish the set goals and even surpassed the mark.
So today we have delivered 31 projects. We have contributed over $40,000 to Rotary Foundation. Can we please appreciate Rotary Club of Rotary? More than 24 awards. Int'L, we chartered 2 Int'L clubs. These are Dedoko International School and LHS School Ota. The club also sponsored 20 candidates to Raila for the first time in the history of the club. Our number is always 5310. So today we have 35 Paul Harris Fellow. We have 3 Paul Harris Fellow certificates that is still on the way. We have 2 major donors, and we also appeal to our PhD Lake Ibrahim and others that we are looking at in this coming year to be a major donor. It has been a very affirming experience. The standard has been set for the incoming president. I wish the incoming president, Wale Hassan, and his team continued success. Thank you.
Beyond the successful projects, the club won many awards and increased in membership. A commemorative compendium as president 2020 to 2021 was unveiled in her honor. For everyone who made her service year a success, she expressed so much appreciation.
It has been a very affirming experience. The standard has been set for the incoming president. I wish the incoming president, Wale Hassan, and his team continued success. Thank you.
High point of the event was the transfer of paraphernalia of office to the incoming president, Wale Hassan.
Congratulations to the incoming president. Congrats.
I know it's a big shoe, but I also want to tell you, assure you, that if I need to go and increase my feet, I will fit into it. And to the glory of God, the first joy came in this morning. This morning that we are doing transfer of leadership, the first joy that came was that we were given the opportunity to present a school, a public school, that will enjoy ICT project of the district. We are in already. It is my pleasure and my wish that we extend the activities of the club beyond Nigeria as we have been doing. Also on that, we are working on a project with Canadian government, which we have written a proposal on, and by the grace of God, I know we will get some global grants. We want to do what the OP has laid down, ensure that we improve on it, so that the people coming behind will also have some legacies to improve on.
My advice to Rotarians and Nigerians is to continue to give to humanity. Let's continue to give without expecting anything in return.
My advice to him is for him to really emulate the outgoing president, because this world is not judged, will not be judged by your personal achievement. We will not judge you by the number of houses you have, by the number of cars you have, but by the number of lives you have been able to touch?
He has a lot of work to do because this woman has really given a lot to Rotary Club of Otta. And this woman has exposed Rotary Club of Otta, and Rotary Club of Otta has competed with top Rotary in Rotary clubs in Lagos. So this incoming president, he has to work. And but with his speech today, I believe he has something up here. He's going to perform.
The Lagos State government, in its bid to prevent further spread of COVID-19, carried out an inspection over the weekend at the Synagogue Church of All Nations. The inspection, which was led by the Commissioner for Health, Akin Abayomi, and the Lagos State Safety Commissioner, Larry Mujala, was aimed at ensuring that the church observes all COVID safety and prevention protocols as they prepare for the funeral of its founder, Prophet Temitope Joshua. Akin Abayomi said that the inspection is in alliance with the third wave mitigation strategy of the Lagos State government. He added that the funeral is an important event that should warrant strict adherence to COVID safety protocols. The commissioner also noted that some areas of the church infection prevention protocol needed strengthening, and as such, marshals and biosecurity experts have been placed on ground to monitor the situation and work with the church to ensure safety. While speaking, Akin Abayomi said visitors coming into the country will undergo the mandatory 7 days of isolation alongside testing before they will be allowed to participate in any of the activities. Others involved in the inspection include Ismail Abdul Salam, Incident Manager of the Emergency Operations Center for Lagos COVID Response, members of the Lagos State Ministry of Health Biosecurity Team, officials of the Lagos State Safety Commission, and representatives of the Federal Ministry of Health Sport, Health Services.
Welcome back. I have seen many marriages dissolved due to the problem of infertility, with the woman most times bearing the brunt. Infertility is prevalent worldwide, affecting about 5 to 8% of couples. Prevalence of infertility in sub-Saharan Africa is higher, with 10 to 30% of couples affected in Nigeria. Infertility is one of the commonest reasons women seek gynecological consultations, as many fear the negative consequences of childlessness resulting from societal pressure. Couples who cannot conceive often experience emotional and psychological trauma. Sadly, societal norms dictate that the woman is the cause of the infertility. I spoke with some medical experts about this issue. I am sure you begin to see things differently after listening to them. They will also be telling us about the causes of stillbirth and other gynecological problems.
One of the common causes is blocked fallopian tubes. And when the fallopian tubes are blocked, the passage, the sperm and the egg cannot meet because of a physical obstruction. Now, but coming closely behind that is male factor infertility, low sperm counts. So in 50% of couples, there is a male factor. Now, because of the way society it's the women that go to the hospitals, women that get checked out, it's the women that engage the doctors. Men are rather reluctant participants.
We have to start educating our girls very early, when they're in school, about the potential causes of infertility and how they can prevent it. So I think education is key from a much younger age, reducing the risk of things like sexually transmitted infections, because that causes blocked tubes, and that definitely causes infertility. Unfortunately, we know that because we know that it's not just the women that can have challenges; men can have challenges too. And globally, we know that sperm is not as good all over the world. It's getting the sperm parameters are getting a bit more reduced. So again, ensuring that our men stay healthy, keep their weight down, minimize alcohol, minimize smoking, wear appropriate clothing. These are all things that will help from an environmental or socio-cultural point of view to try and help reduce that burden. But the main thing is that once you have a challenge, do not wait too long. A lot of things that we see are couples who are waiting 5 years, 7 years, and then they come to us. And it's important to know that for a woman, the longer you wait, every day your fertility reduces. So once you've identified a challenge, it's best to seek expert help from a trusted, validated, quality-assured specialist, like a gynecologist or fertility clinic, to try and get your assessment done very soon so that you can start getting help quicker. Therefore, your chances might be a little bit better.
Well, the burden is there. It's been with us for a long time and it continues to be with us. In our gynecological clinic, for instance, 7 out of 10 people who come there are coming for infertility issues. So it shows that the problem is still very rife. It actually even seems to be on the increase despite the advances in medicine, because some of the lifestyle habits, and social things that people involve in are actually worsening infertility instead of bringing it down. So it's a reason for us to continue to have conversations concerning the knowledge about the evaluation of and the treatment of infertility. For instance, things like obesity, because when people become obese, it affects their fertility cycle. Increased sexual activity, especially unprotected sexual intercourse with sexually transmitted diseases, that will also lead to infertility. So there are so many other little things, dietary things, poor eating habits, smoking, use of drugs and things like that. So all those things are, promoting infertility more, and that's creating, a more challenge for people in terms of getting pregnant. Up to about 30 to 40% of cases now are due to problems in the man and not just in the woman. Male sperm count is also on the decrease generally, showing that the men too are carrying a big share of the responsibility when it comes to causes of infertility. So it's something a couple have to go through together, and it's not just something that the woman has to go through. So, the evaluation has to be done. Support from either side, of each of them, both of them supporting each other and working through the challenge together is very critical. Of course, that support between both of them, and they need support of friends and of family. And it's up to the man to protect his wife, just as it is for the woman to protect her husband if he's the one with the issues, where fertility issues arise. So a couple have to look at it as something that concerns both of us. It's something we have to go through together. And there are means for us to overcome this challenge, because through knowledge, through proper evaluation, seeking healthcare in the right places, they can actually achieve their dream of having a baby together.
So get pregnant and they miscarry. What causes miscarriage?
Well, there are so many things that cause miscarriages. In fact, you'll be surprised to know that almost 1 in 2 pregnancies miscarry. That's 50%. But then, that is when we are talking of before the woman knows she's pregnant. Some the woman may not even realize she's pregnant. By the time we are talking about a woman knowing she's pregnant and she has a miscarriage, it could be as high as 15%. And there are so many reasons for it. The most common reason we say is because abnormalities as the baby is forming, because when you have a baby, it's not like if you just have a baby, boom, it's going to develop the kidney, it's going to develop the brain, it's going to develop the heart. So in those first 3 months where it's forming all those things, if something goes wrong, then the whole pregnancy collapses, and that causes a miscarriage. Other things will be, of course, things like infections, some things like some blood group abnormalities. If the woman has some, because the woman homes the baby, the woman is the house of the baby, so if the woman has some medical issues, that could also affect the baby. She has thyroid problems, she has diabetes, she has hypertensive diseases in pregnancies, she has abnormalities in the womb, fibroids, what we call polyps. She has weakness of the neck of the womb, which we call the cervix. That will also cause a miscarriage. Then other things, trauma. She hits her stomach or somebody hits her there. What else again? Abnormal sighting of the placenta. So there are quite a host of things which could actually cause pregnancies to miscarry, and that's why it's important for couples to seek evaluation. In fact, in some people too, another common thing is where the body rejects the pregnancy. The body attacks the pregnancy as if it's a foreign agent, as if it's an infection or something like that, So all these things need to be evaluated to know, resource factors, I said blood group abnormalities. So all these things need to be evaluated to see what the exact cause is for each person. What happens for A may not be the same thing for B. And pregnancy loss really is only a problem when a woman has about 3 in sequence, because it's not unusual for a woman to have one pregnancy loss now and the next pregnancy to be completely perfect without any medical intervention. So we are spiritual beings, and people always want to look at that, and we have to ask ourselves why. Is it because it's the easy way out without any stress? Somebody just touches you or speaks and things change? Probably. But we must also recognize the importance of medical knowledge and scientific knowledge. I tell people who go to spiritualists or who are religious that all this knowledge doesn't come from the devil. It's God that has given us enlightenment. So seek medical help. Nobody is saying you shouldn't do your prayer. Still do your prayer. You understand? But you must be careful of what goes into your body, because you have to be sure it's not going to harm your body. But there are means of treating these things. And if you seek medical knowledge and scientific knowledge, we all drive cars, we all use mobile phones, we all go in aeroplanes. These are products of science. So same thing too, we should also lean to that. But we still pray inside the plane because we are not just going to say we are leaning on science.
As many families that are out there waiting, I waited, I didn't give up, and I have my own testimony. I encourage them to wait and never give up, and surely they will have their testimony. And most importantly, they should work together as couple. You cannot do it alone as a man, you cannot do it alone as a woman. You must work together as a couple to make it happen. So don't give up and keep pressing on. If you have pressure, all I will say is, as a couple, work together as one. Don't allow the external pressure to pull you down. Don't allow the external pressure to make you lose focus. If your focus is to carry your children, be focused. If you are going through treatment, be focused. If you are praying, and be focused even with your relationship with your husband or wife.
Now you talked about stillbirth. Stillbirth is an issue.
Yes.
It's happening here and there. What causes stillbirth?
It's a very tragic thing to have to go through. A stillbirth is basically when you've carried a pregnancy for quite a significant amount of time, and then you give birth to the child, and the child has already obviously passed away. The majority of cases don't have any causes, to be honest, but we know that there are certain conditions that might be associated with increasing the chances. So, for instance, if you have uncontrolled diabetes, type 2 diabetes in pregnancy, that actually increases the chances of having a stillbirth. So it's very important, if you know that you're diabetic before pregnancy, to ensure that you're seeing a doctor who knows how to manage diabetes very well and keep that under control. Other causes include other associations are when you get very high pregnancy-induced hypertension. So not your regular hypertension, but like a hypertension that develops during pregnancy called preeclampsia. Now that can lead to the baby not growing very well. And if a baby is severely growth restricted during pregnancy, that can also increase chances. Hypertension that comes during pregnancy called preeclampsia, and that usually leads to babies that can be very small in size when they're growing. And obviously babies who are much smaller are more at risk of being a stillbirth. But like I said, most things are unknown, but certain things are unpreventable. So things like diabetes, blood pressure, you can control that quite well. But some things are unpreventable. For instance, the placenta, which is obviously the life support of the baby, can suddenly just separate prematurely from the baby. And that can just cause the baby to be starved of oxygen. And unfortunately, if you don't catch that in time, that will usually end up in a stillbirth as well.
Some people could have gone to a clinician and they say the tubes are blocked and say you can never have a baby. It's not true. Awareness makes you know that you can have a baby by IVF, you can have a baby by even bringing out your eggs, the husband's sperm, and putting into a surrogate. Even when a woman doesn't have a womb, she can still have a baby. That means her eggs are viable, and in cases you can use donor sperm or donor egg. There means, and that's why you must visit a fertility specialist. You must seek for help. You must go online. You must seek for counseling, and then you can ask questions. A lot of crimes that people commit is because they have relegated themselves to think that there's no solution for them. So the best way is to go the wrong way. People must stop patronizing wrong places and go to the experts to get results for their infertility challenges.
If you're just joining us, it's Int'L on AIT. Now I'll be taking you through our nutrition segment.
The carrot is a root vegetable, usually orange in color, though white, purple, and other varieties of colors do exist. People have been eating carrots for over 5,000 years. The plant, according to researchers, originated in the Middle East and Afghanistan. Carrots was originally cultivated for its leaves and seeds. Carrot is a nutrient-dense root rich in antioxidants, fiber, beta-carotene, other vitamins and minerals. Consumption of carrots is good for vision, promotes hair growth, weight loss, regulates blood pressure, lowers cholesterol levels, and helps eliminate toxins from the liver.
On our clinical segment, we give you powerful tips to stay healthy.
Nicotine is one of the major active ingredients you have in tobacco. It's a major respiratory stimulant. Now, you do know that one of the most popular brands of cancer is cancer of the lungs, and tobacco is a major offensive agent that triggers this. So it's not something we want to support. It's not in the best interest of anybody. In fact, it's just because people are foolhardiness is a reality of the human life. When people give you a pack and you see on that tobacco smoking is dangerous to health and you still consume it, something is wrong somewhere.
Our perception segment, your opinion counts to improve human lives and the Nigerian health sector.
All the money, the so-called COVID, or have they gone to warehouse the money to? We should use the money where we need the money.
This is where we draw the curtain on the show today. Please join us same time next week for another exciting edition of the program. My name is Ushuomowa Daniels. Please keep staying safe.